Indirect acceptance and its impacts on dietary choice, smoking cigarettes, behavioral health, and mental well-being. By Nisa Pasha. Mental health is a dynamic interplay of cognition, emotion, behavior, and environment. Among the subtle psychological mechanisms that influence mental and physical well-being, indirect acceptance stands out as both a coping strategy and a potential source of harm. Indirect acceptance involves acknowledging thoughts, behaviors, or environmental stressors without direct confrontation or overt suppression. While it can support emotional regulation in certain contexts, it can also contribute to depletion in physical health, behavioral wellness, and overall regeneration, particularly when applied to dietary habits, substance use, and systemic interactions. This article explores the effects of indirect acceptance on dietary health, behavioral health, and mental well-being, highlighting the psychological mechanisms, physiological consequences, and strategies for peer-led intervention. Understanding indirect acceptance. Indirect acceptance is a cognitive emotional process whereby an individual recognizes potentially harmful behaviors, thoughts, or systemic constraints without actively challenging them. It differs from passive avoidance in that it often involves internal awareness and subtle cognitive reframing, but it may not always result in protective or corrective action. Key features of indirect acceptance include acknowledgement without action, recognizing a risk or harm without confronting it or intervening. Cognitive rationalization, reframing potentially harmful stimuli as acceptable or unavoidable. Emotional suppression, reducing outward expressions of frustration, anger, or anxiety. Behavioral tolerance, allowing harmful behaviors to continue, sometimes subconsciously, for social, environmental, or emotional reasons. Indirect acceptance and dietary health. Dietary habits are deeply connected to mental and physical health. Foods such as whole grains, wheat, and oatmeal are often considered beneficial due to their fiber content and nutrient density. However, indirect acceptance in dietary contexts, such as consuming these foods despite personal gastrointestinal intolerance or unresolved digestive issues, can lead to subtle but cumulative harm. Mechanisms of dietary depletion. 1. Incomplete elimination. High-fiber foods increase stool bulk, but if bowel function is inconsistent or digestive processes are impaired, toxins may recur and accumulate, causing systemic stress. 2. Internalized stress. Individuals may feel they should tolerate certain foods, suppressing discomfort or anger, which creates psychological tension. 3. Contradictory nutritional messages. Indirect acceptance of dietary norms without personal adaptation can create cognitive dissonance. The body reacts negatively, while the mind insists it is acceptable, healthy. And inflammatory and microbiome disruption. Chronic tolerance of foods that irritate the gut can contribute to strong inflammation, digestive discomfort, and reduced regeneration. Peer and mental health settings. Smoking is often tolerated in day treatment programs or peer environments despite known health risks. Indirect acceptance manifests when staff or peers do not actively intervene or educate regarding respiratory, cardiovascular, or medication-related risks. The behavior is normalized, creating peer pressure to tolerate or adopt the habit. Warning signs of harm, including early symptoms of illness or medication interaction, are ignored or rationalized. From dietary indirect acceptance. Autonomy reduction. Indirect acceptance can make individuals feel compelled to conform to harmful norms, undermining personal agency and self-care. Psychological and emotional impact. Cognitive dissonance. Awareness of harm clashes with observed or permitted behavior, causing internal conflict. Suppression of emotional reactions. Anger or concern about peer health may be repressed to maintain social harmony. Normalization of risk. Repeated tolerance of harmful behaviors reduces vigilance and self-advocacy. Bullet summary: behavioral health impacts. Physical harm from prolonged exposure to tobacco or substances. Emotional suppression and internalized stress. Reduced efficacy of medications and health interventions. P. Compounded depletion of physical and cognitive resources. H2. Strong interaction of dietary and behavioral indirect acceptance. Strong H2. P. When indirect acceptance occurs in strong both diet and behavior, the effects are strong synergistic and potentially compounding. For instance, smoking and dietary strain. Nicotine may disrupt nutrient absorption, while high-fiber foods may exacerbate gastrointestinal stress, producing recurrent depletion of physical health. Emotional suppression. Tolerating harmful behaviors and uncomfortable dietary reactions reinforces internalized anger, stress, and anxiety, reducing resilience. Cognitive dissonance. Individuals experience tension between health knowledge and tolerated behavior, undermining self-efficacy. Systemic reinforcement. Environments that normalize harmful habits or overlook digestive needs can indirectly signal complacency with risk, affecting decision-making and personal health management. Bullet summary. Gastrointestinal and respiratory strain, P. Reduced cellular regeneration and detoxification, P. Heightened internalized stress and emotional suppression, P. Lowered vigilance for warning signs of health complications, P. H2. Psychological mechanisms behind indirect acceptance. H2. P. Several psychological processes underlie indirect acceptance. P. UL. Leo. Normalization. Repeated exposure to tolerated behaviors reduces perceived risk. P. Cognitive reframing. Strong. The mind rationalizes discomfort as acceptable or unavoidable. P. Emotion regulation via suppression. Anger, frustration, or anxiety is internally contained rather than expressed. P. Learned helplessness. Systemic constraints or peer behavior may reduce perceived agency, discouraging proactive health decisions. Leo. Behavioral. Reinforcement. Tolerance of harmful behaviors can lead to habitual cycles that are difficult to interrupt. Peer perspective. For mental health consumers, understanding these mechanisms empowers self-awareness, reflection, and eventual re-engagement with health behaviors. Peer-focused strategies for mitigating indirect acceptance. Effective peer support and harm reduction strategies include dietary interventions, mindful eating practices, encourage awareness of digestion and physical reactions to foods. Personalized nutrition planning, adapt high-fiber foods to individual tolerance levels. Journaling and reflection, track physical responses and emotional reactions. Interventions, smoking alternatives, mindful breathing, stress management, or behavioral substitutes. Peer accountability, group discussions about tolerance, health risks, and coping strategies. Medication monitoring, observing side effects and interactions, particularly with substances. Emotional and cognitive strategies. Validation of emotions, recognizing anger, frustration, and anxiety as legitimate. Reflection and cognitive restructuring, identifying internalized risk tolerance and challenging harmful patterns. Empowerment through choice, encouraging informed decisions about diet, behavior, and health practices. Bullet summary, peer-focused actions, mindful eating and dietary monitoring. Reduction strategies for substance use, PLI. Emotional validation and peer-led reflection, PLI. Cognitive reframing to reduce internalized conflict, PLI. Advocacy and autonomy reinforcement, PPS. H2. Strong, systemic and organizational considerations, H2. Indirect acceptance is not only an individual phenomenon, it is often reinforced by strong systemic practices in mental health, day treatment, and behavioral health settings, PLI. Lack of consistent enforcement of health policies, PLI. Tolerance of risk behaviors, strong, without education or intervention, PLI. Limited staff training in harm reduction, PLI. Insufficient individualized attention to dietary or behavioral needs, H2. Addressing these systemic issues requires, PLI. Peer-informed policy recommendations, Training on harm reduction and indirect acceptance impacts, PLI. Integration of lived experience perspectives into program planning, PLI. Continuous feedback loops between peers and case managers, H2. Inspirational insights and motivational takeaways. Despite the challenges posed by indirect acceptance, peer consumers can reclaim agency, strong, by observing and understanding internal responses to diet and behavior. Engage in strong, peer-supported reflection to address suppressed emotions and cognitive dissonance. Use lived experience to strong, educate peers, staff, and community organizations about the subtle harms of tolerated behaviors. Develop strong, holistic wellness strategies that combine mindful nutrition, harm reduction, and emotional regulation. Recognize that strong healing is iterative, and that small steps toward agency, awareness, and balance accumulate over time. Peer motivation examples: journaling about emotional and physical responses to diet and smoking, small group workshops on harm reduction and informed decision-making, daily mindfulness practices to restore emotional equilibrium, peer-led advocacy initiatives to improve systemic support in treatment programs. Conclusion: indirect acceptance is a double-edged mechanism. It can preserve emotional equilibrium and reduce immediate conflict, but may also contribute to cumulative depletion in dietary health, behavioral well-being, and mental resilience. For peer mental health consumers, awareness of these patterns is crucial. It illuminates the hidden costs of tolerated behaviors. It empowers peers to reclaim autonomy over health decisions. It fosters healing through reflection, support, and harm reduction strategies. By understanding the interplay of dietary tolerance, behavioral risk, and systemic influences, peers and practitioners can create environments that support both emotional regulation and physical regeneration, transforming indirect acceptance from a source of harm into a catalyst for informed choice, resilience, and community-based mental health empowerment. If you have specific questions or concerns, feel free to share. Hope you found this insightful while grasping the key components. To chat in a peer counseling session revolving around this post or another topic. Mental Health Revival, seeking to inspire a unique perception of mental health awareness and harm reduction.